That's better. Right, sorry about that. Right, yeah, so we've got the patient face down on this specially curved mattress. This will allow me to get better access to the affected part of her spine, yeah, and also to reduce the pressure on her chest, abdomen and pelvis. So the first procedure we're going to be carrying out will be making an incision from just above the coccyx there up to between 6 and 7 of the lumbar vertebrae. We'll then lift the muscles carefully off of her back to expose the back of the spine, and the affected tissues or nerves under, once we've performed the laminectomy, will be removed little by little just to take the extra pressure off of the spinal curve. Okay?
Okay.
And obviously once adequate decompression has been achieved to my satisfaction, the muscles will be stitched back together and the incision will be closed and stitched up with number 4 sutures.
Alright, perfect.
Just to keep it closed, we'll be then administering 7 steel staples that will keep the wound closed until it's fully healed, which I'm estimating to be within 7 to 10 days. In the meantime, she'll be in a wheelchair and then she'll be able to walk normally, which is my main aim. Okay? All good. Right, well, if you could just hook sugar up to the main IV drip, and we can measure our vital signs as well. And then place the oxygen mask carefully over her mouth and nose.
Alrighty, there we go. I've disconnected her from the previous IV drip. I've just moved her onto this one.
Thank you.
Alright, perfect. Alright, let me just make sure this mask is placed at a nice angle over her features. There we go.
Oh, just raising the bed a little for me, Ted. Thank you.
Yep, just a little bit there.
Thank you so much, Teddy. Yeah,
that's
helped.
Brilliant. Thank you.
Doing my best.
Let me just move the lights in place a little bit. There we go.
Yep, that's it. Highlight the area. Right, let's
shall I bring over the forbidden monkey sauce?
Yes, please.
Forbidden monkey sauce, yeah.
Wonderful. Alright, let me just get it set up for you. Place it in a tray. Alright. Here you go, so we can sanitize the area before we open her up.
Yep. Do a good scrub of iodine around the area. Killing the possibility of any germs.
There we go. Ooh.
Oh, I see.
The generator should kick back on soon, hopefully, fingers crossed. Ah, there we go.
Yep. All good, hopefully. Yep. Right. Just roll back the gown here. Okay, right, I'm just marking with the marker pen along the spine there. Okay, I'm going to make the incision from just above the coccyx here in a straight line along the vertebrae up to lumbar 6.
Perfect.
There.
Right, let me just grab some clips for you so we can hold the space open.
Yes, please. Got the nice G clips. and I want you to place them either side over there, so then I've got access to the back muscles.
Alright, perfect.
That's it, that one on the right there. Thank you, Ray.
Alright, and that's the second one.
Yep,
Alright.
nice. That's it, jolly good. Okay, now I'm just moving the back muscles to expose the back of the spine. There we go. And now I'm going to lift the lamina. This is the bony arch of the vertebra, so that I can access the compressed nerve endings. Okay.
Beautiful. Can't
Right.
say I've seen one this up close before.
Yeah. Right, I'm just going to pop it over on the table here and perform the laminectomy and scrape about 1.5 millimeters off the surface of the lamina.
Perfect. Should I also bring in the aspirator just in case we get some
Yes,
overflow?
please, yeah.
Of course.
There we go. Okay, that's a 0.5 millimeter. The second. Okay, and just 0.5 of a millimeter more. Right, okay, I think that should do it. Right.
Just one sec.
Mm-hmm.
Kelsey, could I please ask you to go and put on a mask? Alright. Sorry about that.
Yeah, it's okay. Okay, now we're going to carefully place back the lamina over the sacrum. And this should then be positioned. Now we can move those back muscles carefully back over into situ.
Alright, perfect. I'll just
That's
help you
it.
with this side. There we go.
Yep.
Can I get you some section on the beat?
Bit more section. Thank you.
What's going on in here?
Okay. The back muscles placed back into their correct positions. Good work there. Good work, Ray.
What's going on there, lads?
Right. Let me carefully remove the first of the C-clamps.
Perfect. Let me just quickly grab a tray for you to place them in.
Thank you.
Here you go.
Thank you.
Oh, we're going to have to finish them off then.
Second one. There you go. Thanks, Ray.
Alright. I'll just dispose of this in the bin.
Yeah, thank you. Won't be needing them again. Okay, now if you could give me the number 4 sutures we're going to use to close her up.
Of course.
Should take about 15 sutures, and then we use the 7 titanium staples over the top of that.
Alrighty. Here you go.
Thank you. Okay, we'll try and perform micro stitches right along the spine there to lessen any chance of adverse scarring. As you see that I've made the incision right in the small of the vertebral line.
That's going to be a $10,000 fine, I'm afraid.
Okay.
Shit.
These last 2 in. Okay. Now I'm going to place the screws, the staples even, sorry, this first one, and this, along that line.
Hello, Kelsey. I love how I knew your name and I haven't even spoken to you properly. Incredible. I know there's so many new people, I'm so sorry.
Right, now we just apply the compression bandage over the wound.
I heard
site.
you
Of
said
course.
let me whisper.
Alright, you can go on and take off your gloves in a bit. I got it from here.
Thank you. I'll just get myself cleaned up and out of scrubs, and then transfer her back to her
Of
room.
course. Of course.
Lovely. Thanks so much, Ronnie. Brilliant. Well done.
Alrighty. Teddy, could you help me carry her over to her room after I'm done with bandaging her up? Since, you know.